Cool. So welcome to the newest installment of our Decoded series. Today we are going to be focusing on AI and public benefits, the road ahead. Sorry, oh, perfect. Okay. So I've asked this question, how comfortable are you with your AI knowledge? And it seems like a lot of people fall on this middle ground of uh, understanding some things, confused by others, which I think is a totally fair place to be. Great. So on the agenda today, we're going to be covering three categories. The first is AI basics, and it's just what you need to know to join the conversation. It's a really broad category, AI in general, and we're going to just focus in on the things you need to be able to talk about it. The next is AI guidance. So in particular, we'll focus on the executive order on responsible AI that came out last October, as well as USDA's guidance and HHS's guidance that came out this year. And then we will cover AI in practice, walking through some use cases of AI in public benefits. And this is largely focused more on the eligibility and enrollment side of things, but we will cover across the board. If you have questions throughout this process, feel free to drop them in the chat, or I'll pause every now and then for you to come off mute. And there will also be opportunities for you to interact with this mentee as we go on. Great. So let's start with the basics. Artificial intelligence, we'll start with the legal definition, which is a machine-based system that can, for a given set of human-defined objectives, make predictions, recommendations, or decisions influencing real or virtual environments. And it's important to note that AI is distinct from algorithms or automation, where an algorithm is a set of step-by-step instructions to complete a task or solve a problem, and algorithms can vary in complexity. So there are AI algorithms, but there are also a number of algorithms that are very straightforward. And you can think of an algorithm also like a logic tree, a series of steps to walk through. AI is also distinct from automation, where automation is an algorithm programmed to complete the same task and have the same output. And we'll cover how it's different on the next slide, but the most important takeaway from that is automation has the same output, and AI, the output can change over time. There are a number of examples of automation that are not AI. For example, interactive voice response systems, IVR phone systems, that act solely on buttons pressed by callers, press 2, 4, blah, blah, blah. Interactive forms that are based on human-defined logic that might skip fields that aren't relevant to applicants or flag inputs that might affect eligibility. Another example of automation that is not AI is auto-population of data into forms with the opportunity for an applicant to review before submission, or automation that enters data into a case file from a trusted data source and flags the information for a caseworker. So all of these examples I just listed are not AI, and you may be familiar with them, and they may already exist in your local agency or in your state agency. Yes, great. So now I'll walk you through what the AI process is in a very stripped down approach. So if we look over on the left side of your screen, we start with inputting information into an environment. And the type of information that is input can vary across the board. It can be numerical data, it can be images. Sorry, I'm also admitting people. It can be numerical data, images, audio, anything like that. Then the AI system will process information with rules and algorithms, which we covered earlier, just a series of steps. And that system will produce an output. These first three steps are how the majority of automation systems work. What makes AI processes different are the following steps. After the system produces an output, it will then analyze that output. So I came to X conclusion. How did I come to X conclusion? How do I need to adjust to make a better conclusion? After that, the AI system adjusts inputs, rules, or the algorithm to get closer to the ideal output, whatever the ideal output is. Now we're going to cover the basic components of an AI system. Again, today we're focused on the basics. There are much more complex ways to think about this, and there are many more details, but you don't need to know those things to move forward in the conversation and to contribute meaningfully to the conversation. So high level is an AI system, and this is any data system, software, hardware, etc., that operates in whole or part using AI. So it may just be a portion of the system, but it would still be considered an AI system. An AI model is a component of information of a system that implements AI technology, and it can do this using a number of things: computational, statistical, or machine learning techniques, and it produces outputs for a given set of inputs. AI models are trained, meaning they're taught how to adapt over time, and we train AI models using training data. And training data is a collection of information that's used to train AI models. And the data can come in a variety of forms: text, images, video, numerical data, and other things. And the type of data that's used to train is dependent on the type of AI model being developed. Again, AI is super broad, but there are some common types of AI in public benefits. So top level is machine learning. And this is a set of techniques that can be used to train AI algorithms to improve performance at a task based on data. So it's the way in which we use training data to teach AI algorithms to be more accurate or perform better. Then there's generative AI, which you may be familiar with. It's very popular, like in public discourse right now. And this is the class of AI models that generate synthetic content. So it can generate things like images or text, video, audio, and other digital content. And an example of this would be ChatGPT. Or if you use tools like Microsoft or PowerPoint, and your slides can be edited or changed, and it makes suggestions on those changes. That's another form of generative AI. And then last is natural language processing. And this is a type of machine learning technologies that gives computers the ability to interpret, manipulate, and comprehend human language. Cool. So now we're going to cover some key concepts in AI. The first is this concept of human in the loop, and this is going to come up throughout the presentation today. Human in the loop is a collaborative approach that requires human interaction, and humans may actively participate in training, evaluation, or operation of AI system. And a human in the loop approach to AI is often less risky because there's a human to kind of gut check and affirm whether or not something is accurate. Next up is the concept of garbage in, garbage out. And this applies to data in general. But it essentially means that if training data is biased, dirty, meaning it's got a bunch of inaccuracies, that AI system will often replicate and emphasize those biases. So if you have data that is significantly focused on a particular racial group or significantly biased against a specific class, the AI system will often make that bias larger because as it learns, it sort of compounds over time. Next up is rights impacting or safety impacting. And these these terms, rights impacting, safety impacting, come up a lot in the guidance, which we'll cover later. Um, and this can include AI systems that directly control outcomes and AI systems that influence outcomes or decision making. And I'll give you examples of what that means later on. The last example are hallucinations. As the name might suggest, it is when AI creates nonsensical, false, or inaccurate outputs by perceiving patterns or objects that are non-existent. This is a pretty significant problem in AI, and it has not been solved. So it's something to keep in mind as we're thinking about the outputs and the reliability of AI. Okay, we're gonna try this again with the Menti. My next question for you is, how would you describe your feelings about AI? I think I might have to stop sharing and reshare. We'll see what happens. Mhm. Okay, this is great. Let me reshare my screen. Cool, so we're getting a lot of really good answers. I see intimidated, underwhelmed, worried, interested, skeptical, excited, curious, cautious, nervous, wary, cynical, intrigued, overwhelmed.
Hello. Yes,
Ah, yes.
right, right.
Do you have a question?
Okay.
Oh, I think you might not be talking to me. Okay. Cool. So I'm seeing sort of across the board, a lot of people in this middle ground of like cautious, not quite sure, not entirely trusting it, intimidated. So I think there's sort of an uncertainty there, which I think is totally fair. And it seems like it falls on both sides of things, both like intrigued, maybe we think it might help, concerned, maybe we think it might hurt. And I think that is pretty consistent with like what people are feeling across the board. So thank you so much for your interaction with this. I really appreciate it. Next we are going to move on to the guidance that has come out recently. And before we do that, I just want to take a second to pause and see if there are any questions that people might have on the basics that we've covered so far. And again, feel free to drop it in the chat, come off mute, or you can always email me about it later. I'm going to take a pause while you guys are thinking to drink some tea. Okay, cool. I'm going to take that as no questions right now, but again, feel free to hop off mute, drop it in the chat, whatever you need to do. Cool. So we are going to focus on 3 pieces of guidance that have come out in the last several months, and are shaping the conversation around AI and public benefits. We'll touch first on the executive order on the safe, secure, and trustworthy development and use of artificial intelligence that came out of the White House. We will then touch on themes from both of the guidance that came out of HHS and the guidance that came out of USDA. The guidance from HHS is titled, sorry, these are mouthy, wordy, so, stay with me. Plan for promoting responsible use of artificial intelligence in automated and algorithmic systems by state, local, tribal, and territorial governments in the administration of public benefits. Oof. And the next one from USDA is a framework for state, local, tribal, and territorial use of artificial intelligence for public benefit administration. As we move through the presentation, I'm just going to refer to these as the executive order, HHS guidance, and USDA guidance. Cool. So the executive order that came out of the White House was shared on October 30th of last year. It covered a lot of information across sectors, but there are a few key takeaways. So this quote, I think, really meaningfully reflects kind of what people were sharing about their feelings in that last Menti poll. But responsible AI use has the potential to help solve urgent challenges while making our world more prosperous, productive, innovative, and secure. At the same time, irresponsible use could exacerbate societal harms such as fraud, discrimination, bias, and disinformation. It can displace and disempower workers, stifle competition, and pose risks to national security. So we're really grappling with these big ideas of innovation while also protecting against personal and societal harms. The executive order seeks to establish the following things across sectors. It seeks to establish new standards for AI safety and security, protecting Americans' privacy, advancing equity and civil rights, standing up for consumer, supporting workers, promoting innovation and competition, advancing American leadership abroad, and ensuring responsible and effective government use of AI. That last one, ensuring responsible and effective government use of AI, largely impacts the stuff we're about to cover. Section 7.2 of the executive order, if you're looking at it, is the one that focuses on AI in public benefits. From that section, the kind of key takeaways, top of the line is that it had requirements for federal agencies to publish information on AI in 180 days, which was about by the end of April 2024 of this year. These are direct quotes kind of pulled from it. One says that the Secretary of HHS shall, within 180 days, publish a plan addressing AI systems. And the other says that the Secretary of Agriculture shall, within 180 days, issue guidance around AI. The executive order also touched on accelerating the hiring and training of AI professionals in government, and it seeks or sought to help agencies acquire AI products and services. So, as I said in the last slide, a key takeaway from that is from the executive order is that HHS and USDA needed to come up with their own guidance or frameworks. It's clear that these two pieces of information, the guidance and the plan, were very much created in alignment. And the agencies themselves have said that they were hoping to stay in lockstep across the board as they continue to work on AI. The guidance that HHS and USDA release, it definitely skews towards defensive guardrails. It seeks to strengthen governance for AI, manage risks from AI, and advance responsible AI implementation. It prioritizes protecting safety and rights over implementing new innovative solutions. There's a big focus on training and hiring staff with deep AI knowledge, and it will continue to be a priority and concern as AI continues to grow. Something really interesting that was in this guidance is that there's a focus on the role that vendors play in the process. And a general takeaway is that vendors are accountable for the AI tools that they implement, and there are processes, particularly during the acquisition process, that should be followed to make sure that AI tools are meeting the rights and safety, the concerns around rights and safety. A question from the guidance is enforcement of the guidelines is unclear. It's not entirely clear what happens when these standards aren't met. It's also not clear the force behind them, meaning like whether or not things are entirely required or suggestions, things like that. It is important to note that the agencies only had 180 days to produce this guidance. So it does set expectations, but there's definitely more to come, and we'll see how the conversation changes over time. So now we're going to touch on some themes from the AI guidance. This is not broken out by like separating HHS and USDA because they're in such tight alignment. The themes are shared across both documents. So we'll walk through things that are shared in both. I touched on this earlier. As promised, it's going to be throughout the presentation. This idea of rights and safety impact. From these documents, there are 3 categories of rights and safety impact. The first, this green category, is unlikely to impact rights or safety. And this is uses of AI that enable more effective programs, but don't affect outcomes. So this could be OCR, document transcription, it can be sentiment analysis for customer experience, or an IVR that uses voice recognition rather than pressing buttons. I'm going to list out examples here, and then later in the presentation, we'll talk more in depth about some examples and why or why not they are rights impacting. This middle category is what called may impact rights or safety. And this is uses of AI that don't directly conclude outcomes or decision making, but it does inform outcomes or decision making in ways that could impact rights or safety. So this is like public-facing AI chatbots, or staff decision support tools, or even translation. And again, we'll cover examples of this later. And then this last category, which is like big red flag, not recommended, please don't do this, is presumed to impact rights or safety. And this is uses of AI that directly change outcomes of services. So this can be like benefits administration, fraud analysis, nutrition tailoring, and health screening. Each AI implementation poses a different level of risk, and these levels of risk can be explored through a number of tools, but the one recommended in the guidance is NIST's AI risk management framework. Cool. So another theme that came up from this guidance is the agency's responsibility to protect rights and safety. Underneath that is this concept of whether or not notification is necessary. From HHS's guidance, it says agencies may be responsible for notifying HHS and or obtaining HHS approval for implementing AI that's presumptively or may be rights or safety impacting. So that's that yellow and red category. From the USDA guidance, notifying FNS is a little unclear as well. It says agencies must determine what program system changes and functions incorporating AI trigger notice. So it's up to the agencies themselves to determine whether or not they need to notify FNS or get approval from FNS. And this is based off of existing FNS program requirements. And this particularly applies to things that may or presumptively are rights impacting or safety impacting. Regardless of notification, all AI implementation must protect privacy and safeguard against bias and discrimination. An agency should consider which decisions or actions could result in significant impact on rights. And in those cases, should provide additional human oversight, intervention, and accountability. Agencies also need to provide other options for people. Not everyone is going to feel comfortable with AI. As we covered earlier, there are a lot of different feelings and levels of trust with AI. So agencies should provide easy to find and accessible opt-out options for public-facing AI. So it doesn't necessarily make this recommendation for like caseworkers that are working with AI, but anything that is public-facing should have an alternative. This alternative should give the option or the ability to interact with a human wherever possible. And when that's not feasible, an automated system that does not use AI should be provided. So again, giving people the ability to opt out, opt in, and this concept of like consenting to interacting with AI. And it's important to note that it says easy to find, so it shouldn't be like buried in like legal jargon. It should be very apparent to people that they're interacting with AI, and that they have the option not to. Next up is this concept of agency control over AI systems. Um, this portion, these next two slides are really crucial to me personally. It says that agencies should seek to exercise control over implemented AI technologies rather than just handing over control to third-party vendors. There is a risk in AI of insufficient oversight and governance to make informed procurement decisions, manage vendors, or audit systems. Agencies should ensure contracts retain sufficient rights to data and future system improvements. Agencies should also anticipate that vendors may respond to proposals with AI solutions, even if AI features weren't requested or anticipated. An agency should again ensure that the contracts prevent unauthorized disclosure of data, particularly personally identifiable information, or PII. So there's this concept that AI uses a lot of training data and interacts with a lot of data large scale, and it's important that agencies seek to protect clients and their data, and making sure that it's not being used in unauthorized ways. And then next up is this idea of gathering information from vendors during acquisition. So agencies should use the acquisition process to gather information from vendors to identify and mitigate risk. So that means that like early on in the process, there are questions that we should be asking to make sure that we are understanding the risk that we're taking with an AI tool. And transparently, these are concepts that can be applied across the acquisition process, whether or not something is an AI tool or another type of technology. So some examples of information that agencies could gather during the acquisition process is the intended use. So in what context and for what purposes is this AI being used? Another example is training data. So what is the source of the data? How does it reflect real-world contexts? What's a summary statistic of the data population? So what race or ethnicity is in this population, what ages, genders, income brackets, etc. And then there are the testing results. So one, how and in what context is this AI system being tested? What are the findings from those tests? And what adjustments are being made because of those findings? Like we've mentioned throughout the presentation, AI systems are dynamic. They change over time. And so it's important that testing is consistent and integrated back, meaning like the findings are then applied and changes are made from those findings consistently throughout the process, because AI systems change so much and are so dynamic. And then there's the auditing of results. So vendors may be expected by agencies to disclose whether the system or data has been assessed for bias and other risks, and what the results of that assessment is, and any actions taken after that assessment to mitigate findings. So again, it's this idea of like, are we testing the system? What is the outcome of that? And how are we making sure that we're making adjustments to protect the users? This last bullet point I think is a really juicy one, and this is pretty directly from the guidance. Traditional procurement approaches that evaluate systems during the purchasing process but apply little or no diligence to ongoing monitoring will not suffice for AI systems which are dynamic. So this concept of diligence and ongoing monitoring is a really crucial part of AI systems. But I would emphasize that I think this applies to technological systems in general, and we have a lot to learn from this guidance that can be applied more broadly. Next is this idea of human oversight and training. So I mentioned this earlier, but uses of AI that include human oversight can present lower risks if best practices for human in the loop are followed. The guidance also recommends consulting workers during development. Workers like caseworkers are often subject matter experts and understand complexities that the people building the systems and the training data might not be able to grasp. So it's important to integrate that human subject matter expertise throughout the process. Um, Agencies should provide adequate training for all staff around AI, whether or not that staff members directly interacting with AI as like a human in the loop component. Staff should still have an understanding of what AI is, what its risks are, how it works on a basic level. Um, there are some staff who are going to be providing direct human oversight for AI functions. Those staff should be trained on AI topics, and they should also receive training on the business process that the AI function is trying to replicate. Um, it's important that they have an understanding of that process and can really um, hold the system accountable rather than just the human being a rubber stamp sort of step in the process. Um, Ongoing monitoring of the automated or algorithmic systems must include periodic human reviews. So again, we don't want just a computer approving a computer. It's important that a human every now and then is in the process, not just as a human in the loop, but also monitoring the general output and the themes that are coming out of this AI system. And AI systems should include the ability to be shut down if needed without disruption of service delivery. So in our worst case scenarios, there are times where AI may be really critically negatively impacting service delivery. It might be hindering people's ability to access services. It may be leading to extremely long wait times, things like that. In that case, systems need to be able to work entirely without using AI. Cool. Okay. So that leads us kind of to the end of walking through the guidance. Looks like we're doing good on time. I'm going to start up this Menti. So my question to you is after that information, knowing that you haven't had a ton of time to process, what stood out to you from the guidance? And it can be something positive, it can be something negative, questions you have, um, anything like that. I'm gonna stop sharing and refresh, and then we'll see what you guys have to say. Mm-hmm. Mm. Seeing some interesting answers. The guidance will make it really hard for states to implement AI, which is not necessarily a bad thing. Expectation seems to be that industry will regulate itself. Just how much guidance is necessary. Yep. See if I reshare, if it'll populate as you guys are um, filling it out. Fingers crossed. Dang, no. Unfortunate. Acknowledgement that the normal procurement process often fails. Mm-hmm. Watching out for vendors including AI when it's not asked for. Yep, it requires third-party contractors. Yeah, this concept of information to be freely used by AI, whether or not people feel comfortable or safe with that. Totally. All right. I'm reaching the end of my abilities on Menti. I can't get it to display um the answers, so hopefully you can see them. Uh or you heard me reading out some of the answers. Um yeah, sorry about that. I'm learning just like you. Next up, we are going to be walking through some use cases and public benefits. Someone mentioned that this tiered approach, this red, yellow, green situation stood out to them, and that's kind of what we're going to be covering in this next portion. We're going to walk through some use cases, and each one will be labeled in which category it falls into under the rights and safety impacting component, and then I'll kind of touch on why that is the case. Cool. So first up, we have chatbots. And this, I think, is kind of one of the earlier implementations of AI that people might be familiar with. So there are a number of use cases. The first is an internal-facing search chatbot that answers questions about program requirements or policies. And this is the user would be caseworkers in this case. And it can direct them to the relevant section of an official policy manual or primary source. But the caseworkers are required to cross-check the manual to confirm the citation before proceeding. So because this doesn't make any direct determinations and the caseworker is required to cross-check, this is unlikely to impact rights or safety. So it's in the green category. We're comfortable with this. We generally think this is okay. Next up are chatbots that use natural language processing to better understand user questions with human-coded logic-based outputs. And this is not generative AI responses. So again, as I mentioned earlier, natural language processing gives computers the ability to kind of analyze and understand human words or language. And in this case, this would be a chatbot where like someone would freeform write their question and the chatbot would send back answers, but they are preset answers. So it's not like the answers will change over time. Because the answers don't change over time, they're preset and a human wrote the answers, this type of chatbot is also considered unlikely to impact rights or safety. A public-facing AI-powered chatbot that answers client questions about eligibility, enrollment, or outcomes may impact rights or safety. It falls into this middle may impact rights or safety category because the answers are not pre-coded by a human being. They fall more into that generative category, but they also don't make direct determinations about eligibility. So it's not saying like, yes, you're eligible, here's the amount you're eligible for. Instead, it answers general questions, but because the answers produced may deter people from applying for benefits for which they are eligible, this falls under the category of it may possibly impact rights or safety, so we should be cautious with implementing something like this. Cool. Next up, under use case categories is translation. So, this first case is a creation of first drafts or translated materials that a human with language expertise will review and approve. This is unlikely to impact rights or safety. Because it's a first draft, it's not the final thing that a person is seeing, and because a human will approve or deny, or edit the translated materials, the impact or the negative impact on clients is much less significant. And this is a particularly useful application of AI in agencies that have users that need a number of languages, populations that use a number of languages, because it just makes it faster to translate documents, and the human can spend more time on making sure that the translation is more culturally relevant rather than just trying to just get a basic translation. Another version of translation using AI is translation of program materials without validation by a human translator. This is presumed to impact rights or safety, so we don't want to do this. If you've ever used like a website in a different language and then let Google translate it, you've probably seen that the translation only like kind of makes sense. You can like piece together the vibes of the website, but like it definitely doesn't seem like it was written in a native language. That is one of the reasons why it would be presumed to impact rights or safety. People would not be able to fully understand what the translation even meant, and the translation may give inaccurate information that could impact people's ability to access services. So we don't want to do that. The last translation case is live translation. So this live meaning either in person or live using like a website and it being translated without a person checking it. But here the example is live translation without an interpreter or translator present for an interaction that directly informs an agency decision. So this could be an eligibility interview that uses live translation, a mental health screening, an appeal, a hearing. We don't want to use live translation AI in these cases. We want to continue to have a human integrated into this process. Cool. And then our last example use case is document handling. So I mentioned OCR earlier, optical character recognition. But a use case here is OCR is used to transcribe information from uploaded documents or paper forms. And this is unlikely to impact rights or safety. As a refresher, OCR essentially is if I have a handwritten document, that document is scanned and then the information I hand wrote is converted into like computer digestible text. So essentially converting something from like a written document to like a PDF or a Word document. It's important to note that not all uses of OCR include AI. OCR has been around for a long time, long before AI became popular. But AI can be used with OCR to improve accuracy or processing speeds. So particularly with handwritten documents, there's a variety of ways that people write letters and words. And AI can be used to teach OCR systems to more accurately identify what letters are. It's unlikely to impact rights or safety because it's just a transcription of a document. It's not making determinations off of that transcription or making assumptions about eligibility or access. Another use case of AI in document handling is the reviewing of documents to determine eligibility. This can be an application or redetermination. It can be determining benefit amounts or processing changes, even terminating benefits. Again, we do not want to do this. This is presumed to impact rights or safety. It's in this red category. There's no human in the loop. It obviously can affect people's access to services that they need, like housing and food and healthcare. And we don't want to do that. And then this last category of document handling is creating initial drafts of documents or suggesting ways to rewrite a document in plainer language or with better visual layout. Again, this is unlikely to impact rights or safety. This is just using AI to make recommendations about how something can be improved. And this is a very common use of ChatGPT. So you can take a document that you've written or take an email that you want to write. You can drop it into ChatGPT and say, can you make this more plain? Can you make this more friendly? Can you make this more formal? And AI can make recommendations about how to change that text, but the human in the loop, the person still has the final decision as to what is being written. And because of that, it is unlikely to impact rights or safety. So hopefully this gave you a better idea of some applications of AI and how it connects to rights or safety and where the distinctions in each category is or are. Cool. So this is our last question. We'll see how it goes. What AI example sounds most useful in your state? Or if you'd like, if none of them sound interesting to you, point out which one sounds most concerning whatever you'd like. Hi, Jen.
Simone, while people are answering the question, can I ask you a question?
Sure.
So for the things that fall into presumed to impact rights or safety, does the guidance say that states can't do them, or is that the category that imposes all those conditions?
It doesn't say explicitly that agencies can't do them. It highlights the negative impacts of that category, and suggests that they should not be done. There are lines that kind of suggest that if you are currently implementing AI that falls into this category of presumed to impact rights or safety, that you may have to roll it back. But as I kind of touched on earlier, the enforcement levels are unclear. It's not entirely clear what the consequences are or what actions need to be taken. So I guess it's important to distinguish that when I'm saying don't do this, I'm saying this is not recommended. And
Yeah.
I personally, Simone, don't think that you should be doing it, but it doesn't say explicitly in the guidance, there will be a negative consequence if you do this thing.
But it does discourage states from doing it. It does say
Absolutely.
recommend. So the main category where the conditions in the guidance apply is the yellow, may impact rights or safety. That's when you have to notify the federal agencies and may have to put in these additional safeguards.
Yellow
And
and
then
red.
green.
Yep. But
Yeah,
green
and
is
then green ones, you're good to go. You don't have to do anything different.
exactly.
Okay, thanks. Thanks for connecting those.
Yeah, thank you. Okay, we're getting let's see where we're at. Getting a few answers. So it says, I see making notices more readable sounds like it could be useful. Helping public benefit agencies make more accurate, quicker decisions. Detecting unjust denials. Interesting. Okay. I'm sorry I can't share this. I don't know why it doesn't want to show for all you guys. Maybe if I close voting, it would show up. We'll see. Thanks for being patient with me. I appreciate it. Okay, let's see. Try one more thing. So I see translations, prioritizing work. Interesting. Cool. Oh well. All right. Cool. So thank you so much for interacting with this Menti. You should be able to see the results if you're looking on your phone or on your computer. In this last few minutes, we're going to cover some types of questions that you could be asking, and then we'll leave the last couple of minutes for questions. If there aren't any questions, you get to go home. Cool. So this first category of questions are questions to explore with your agency to prepare for the use of AI. So this is in the world where maybe AI is new to you or to your agency, or it hasn't been implemented and it's being explored. First question is, does your agency have any current implementations of AI? It could be really small portions of AI or really complex things that are already in process, but maybe not fully implemented. And it's important to know where your agency is at in that process. Next up is there any upcoming procurement where AI might be included? Thinking back to that recommendation that vendors may suggest AI solutions even when they're not requested. Another thing to consider is, what's your union's position on AI? Is your union in support of it? Is it not? Are there certain use cases that are that your union is not comfortable with, etc. does your agency have expertise internally around AI? So in this guidance, there's a big emphasis on like building up government capacity to understand AI, but often agencies don't have that yet. So it's important to know what their capacity is. Do they have an entire team? Is there a large focus on it? For example, in San Jose, there's an entire Gov AI coalition that different agencies can join. Is your agency a part of this coalition? Is there someone internally that's just focused on AI? These are things that are helpful to know about your local agency. And does your agency conduct trainings around AI? And what level of training are they doing? Is it broad, sort of in this category of getting people to loosely, more broadly understand AI, or are they doing very technical AI trainings? Again, it's a good temperature check to see where your agency is at with implementing. And then in the case that your agency chooses to implement AI, here are some questions to consider when moving through that when your agency is moving through that process. These might be pieces of information that would be useful for you to have. So the first is there always a non-AI alternative available? Again, this touches on that idea of people being able to opt out of using AI for public-facing tools. The second question is who is interacting with this AI system? Is it clients? So is it public facing? Is it caseworkers? So is it internal? And each of these has a different risk, both because each population is of a different size, but also each population has a different understanding of the system and what's going on. The next question is AI necessary for implementation, and does it solve the problem? For me, this is a huge question throughout procurement processes. Is this additional tool that introduces a lot of risk and complexity, do we actually need it? Or are we just picking the new shiny thing? Does it solve the problem that we're trying to solve? Or is it just what's being presented to us? That's a really important thing to dig in on as AI becomes more popular even when it's not requested. Next up is how easily can this be removed if it's causing rights or safety impacting concerns? Is there a human in the loop? Is there a human component? How will staff be trained on the AI systems? How will that training be maintained over time? How is training data used? And how is bias around that training data assessed, addressed, and mitigated? And then how will people be informed or give consent or have the ability to opt out to using this AI system? So again, these are questions that you can ask if your agency has already chosen to implement AI. All right, we did it. It's time for questions. We are at the end of me talking at you. Are there any questions from the crowd, from the audience? You can drop it in the chat. You can come off mute. You can say this is the coolest presentation you ever went to and you learned so much. I'm your favorite. You can say that too. Not even that, dang, guys. We've got like 2 more minutes.
I'll unmute. This is Pat, and I apologize when I was 9 minutes late to this presentation. Was it recorded? I missed the first part.
Yes.
Yay, okay, then I will listen to the first 9 minutes, but it was excellent. Thank you so much.
Cool, I'm glad. Thanks so much. Well, with that, I will just share this last slide, which has a number of resources, and I will send out this deck and the recording. But these resources, it's the plans and the guidance that we covered today. It also links to the AI risk management framework. There is a use case inventory that you can explore if you want to know more about use cases. As I mentioned, there's also a Gov AI coalition that's coming out of San Jose, and they have some really interesting documents that government agencies can use to kind of beef up their AI abilities. And there was also recently a presentation from Manat, I think it was last week, called The Impact of AI on Healthcare Providers and Payers. So if you're more interested in the healthcare system side of things, or you want to know more about the legislation that's coming out of states around AI, I highly recommend looking at that presentation. With that in mind, thank you so much for your time today. I really appreciate it. And I hope you learned something today that you didn't know before. So thank you so much and have a good day. Bye.